U.S. deficit climbs to $1.3 trillion, and that is just this year alone. Which, when we had David Walker on it, he had said that the total entitlements and everything that have been guaranteed is over $50 trillion. But just since Obama has taken office, the U.S. budget deficit reached $1.3 trillion for the current fiscal year in July, official data showed. News set to fuel opposition to U.S. President Barack Obama's ambitious health care program and climate change proposals. We're coming up on a break. You're listening to Farron and Bryan on The Real News, and we'll be back after a word from our sponsors.
Demanding the rights of we the people, broadcasting the truth, the puppet media dare not report. Long live liberty and death to the new world order. Prepare yourself. This is Real News Radio with your host, Farron.
Hello and welcome to The Real News Radio, your weekly broadcast where we discuss the disinformation, the falsehoods, and the propaganda perpetrated on us by the mainstream puppet media. We're going to get started this hour with a swine flu update, everything that's come out this week about the swine flu, and this was reported by the Boston Globe August 13th, 2009. Massachusetts deputizes dentists, paramedics, pharmacists to administer flu vaccine. Now, this is a mainstream public newspaper, Boston Globe. Massachusetts health authorities took the unprecedented step yesterday of deputizing dentists, paramedics, and pharmacists to help administer vaccines against both the seasonal flu and the novel swine strain expected to make a return visit this fall. Is that not amazing what we are reporting here? I mean, is that not a red flag or what? And in another emergency measure, regulators directed hospitals and clinics to provide vaccine to all their workers and some volunteers. A move designed to keep the medical workforce robust and prevent doctors and nurses from making their patients sick. The actions illustrated the intensifying sense of urgency as health authorities, hospital administrators, and clinic executives across the nation confront the prospect of providing hundreds of millions of doses of vaccine against not one, but two deadly types of flu in the same season. It was also reported this week by U.S. News and World Report, August 12, 2009, deadly fall flu not borne out by facts. The theory that a relatively mild outbreak of new flu virus in the spring predicts a more severe deadly outbreak in the fall isn't borne out by a look back at prior epidemics, two U.S. experts said. Pandemic history suggests that changes in neither in transmissibility nor in pathogenicity are inevitable, concluded Dr. David Morans and Jeffrey Tollenberger, infectious disease experts at the U.S. National Institute of Allergy and Infectious Diseases, part of the National Institute of Health. In an article published in the August 12th issue of the Journal of the American Medical Association, the experts take on a much-publicized theory that's helped stoke fears about a resurgence of swine flu in the Northern Hemisphere this fall. The so-called Harold wave theory stems from the belief that the deadly 1918 flu pandemic began with a milder spring wave of illness, which got more deadly as the virus spread throughout the summer, picking up the lethal mutations. The 1918 Spanish flu is estimated to have killed over 20 million to 40 million people worldwide. Also this week, The Guardian reported Chief Medical Officer reveals swine flu vaccination plans. People with health conditions such as diabetes, asthma, heart disease will be the first to receive the swine flu vaccine in October, the government said today. The vaccination program, which will give priority to those aged between 6 months and 65 years old whose health problems could be aggravated by the flu, will begin 2 months later than the government previously stated. Next in line for the vaccine after at-risk groups will be all pregnant women, subject to licensing arrangements on the most suitable time table to give the jab. People living in households with patients with suppressed immune systems, such as cancer patients receiving chemotherapy or those with HIV, and people over 65 with health problems and with aggravated by flu will also be put at the front of the line. It was also reported this week by World System, August 4th, 2009, swine flu vaccines contain live H1N1 virus. It's not a typo. The main ingredient in the GlaxoSmithKline and Novartis vaccine contains a live virus. A virus meaning it's weakened form of the swine flu virus. Vaccines can be deadly and cause virus shedding. When a person is injected with a live virus, the organism moves through the human body, possibly affecting the host and then exiting through the feces, mucous membranes, and saliva glands of the inoculated person. This is called virus shedding and can last for weeks. Imagine millions of children that will be involuntarily vaccinated this coming fall that will be shedding H1N1 swine flu across the country in sewage drains and possibly passing through the desalination process and into our tap water. If half the U.S. population will be vaccinated with this swine flu vaccine this coming fall and winter, imagine how virulently deadly this swine flu will be on an annual basis. This mandatory vaccination plan will surely cause the pandemic, not solve it. So there's a lot of information out there, and every week we do a swine flu update just to keep everyone informed with what's going on, because it's just amazing the information that is coming out. I'm here to tell you. We reported last week about the International Swine Flu Conference that is being held basically as we speak in Washington, D.C., where some of the topics that they were covering was direct fatality management, tactical operations, activate fatality management operations, conduct morgue operations, conduct final disposition, emergency response management, what to do if the public is unwilling to follow government orders. I mean, it's just on and on and on. So we want to alert everyone to this. After this next break, we're going to play a clip from Paris, Maine, where the National Guard drill at a high school is actually preparing the students there for the vaccinations against their will. And you can see the video on our website, but it is amazing that we're seeing this across the country, and we'll continue to report that. Again, our website's therealnewsradio.com. You can go there, see a lot of different videos. You can email us on air at therealnewsradio.com if you'd like to send us some information. We might post it on the website. If you would like to give us some ideas about protests downtown, we've been having it downtown at the Civic Center. Any other areas that you maybe would like to have in mind, that would be great. Also, LibertyNewsRadio.com. The archives are free now. You can go there and listen to any of the broadcasts. The phone number to listen by phone is 801-769-2970. We've got just a couple minutes before we go to break, Brian. Go ahead.
VIX signals S&P 500 swoon as September approaches. And I know there's people out there with their little notebooks taking financial notes. I know you're out there because I have my sources. Write this one down too. This is from Bloomberg. Options traders are increasing bets as the steepest rally in the S&P 500 index since the 1930s won't survive September. Historically the worst month for U.S. equities. Traders were betting the VIX, a gauge of expected stock swings, would increase 13% in the next 5 weeks, according to futures prices at the end of last week, compiled by Bloomberg. That's the biggest spread since August 2008, before the S&P 500 suffered the steepest two-month plunge in 21 years. The indexes have moved in the opposite direction 81% of the time over the past 5 years. Bloomberg data showed VIX futures above the level of the index show investors expected fluctuations to widen and stocks to retreat. It's a danger sign, said Roger Elka, 36-year options trader who oversees